here we have a really good question that we get a lot. So a chiropractor is asking, how do we actually get personal injury patients through their door? So I'm going to break this down, but a lot of our doctors that we work with are the first point of contact for a lot of cases that we generate because our system, our program generates cases, and a lot of those patients are unrepresented or unattached, meaning they do not yet work with any attorneys. So there's different ways that we can go about bringing people to the doctors that we work with. Each state has laws and parameters that are different from state to state. So for there's three main ways that we go about bringing patients in to the doctors on the personal injury program. Number one, in states that we have access to do this, is pulling police reports. In a lot of states, we have access to get the police report data, make outbound connections as long as everything is compliant with that state and with the laws and regulations in place, then that is a great way as far as bringing new PI cases through the door. So that's number one. Number two is with our program, a lot of doctors, they want to go network with attorneys in their local areas to build connections, refer patients out, get patients referred to them. But it's hard to do that when you don't have patients coming into you first. If attorneys are getting the patients first, then it's much easier for the attorney to refer out. So with our specific program, a lot of patients are going to the doctor as that first point of contact, which then puts our clients, our doctors, in a position to refer out to attorneys and take the data to any attorney office in their area that they maybe want to set up a relationship with, and then they can establish a good connection there. The third way is by getting patients inbound. Inbound is by far the best way as far as getting new traffic through the door. So a lot of people, since most people don't know about the benefits on the medical side of personal injury, if someone gets into an accident, they think about connecting with an attorney or going through the settlement process. It's not super common knowledge about the benefits that the patient has on the medical side. And so, what our team is looking to do is make that more common knowledge for people who specifically have been involved in accidents, showcasing the practice, showcasing the expertise that you guys have, you guys as in the doctors that we work with, the specialty services, the modalities that you cover, and essentially walk that patient through what the next steps are involved on the medical and on the legal side to make sure that they get the best comprehensive care that they need, both legally and medically. So, if you guys have any questions, feel free to leave a comment, send us a message, and we're happy to expand on this a little bit further. But that's a common question that we get asked a lot is how do we get people in? And there's three different main ways that we go about doing it for our doctors.